exploring exactly what's going on is to make sure that these 10 questions have been answered prior to the assessment. My name's Sally Ann. I've been an SPLD assessor for over 25 years. Subscribe to my channel and be the best assessor that you can be. Let's have a think about the current situation with regards to exploring potential visual difficulties and our role as SPLD assessors, and the expectations on us with regards to that. So hopefully you've caught up with the fact that in June 2025, SASC released the new visual difficulties guidance update and also a new visual difficulties screening protocol, which we are asked to put into place from that point onwards. So hopefully you've already found your way to this. If you're not sure what I'm talking about, this is what it looks like. So we have the history questionnaire where we establish where they're up to in terms of eye tests. We want them to have been seen in the past 2 years. And if there are any concerns, we want to know exactly what's going on. Part of the exploring exactly what's going on is to make sure that these 10 questions have been answered prior to the assessment so that you can refer back to the optometrist or refer to an optometrist if there are any concerns in these areas. So do have a good read of the SASC guidance because that is there to guide you and help you with this decision-making process as to whether or not you feel like you can go ahead with the assessment at this point and it's all good to go, or whether you would like an optometrist's opinion before you go ahead and see if there is anything else that can help that individual. So like I said, before the assessment is the time to be administering the questionnaire and the checklist. So it looks for persistent difficulties and it's kind of split into what the person feels, what the person sees and what the person does, and that's what we're trying to ascertain when we are administering those checklists. There's a really useful diagram that you will see inside the visual difficulties guidance. It's this one. And what we have is the stages to go through in terms of gathering information. And you can see that it gives us next steps. What do we do when? So if this happens, you're in the red zone, so you need to refer to an optometrist. If you're in this zone, then it's advised that you send them off to an optometrist, but yeah, it's okay to proceed at that point and no action required. You can proceed with the assessment. So really do make sure you have a good look at that because it really does help when you're trying to make these decisions about whether or not you're going to assess at this point or wait for a vision specialist to have a look and give their advice. So as we know, professional boundaries really do matter. And we're not here as SPLD professionals to diagnose visual stress or diagnose visual difficulties or administer coloured overlay filters as part of a diagnostic assessment. That's completely out of our remit, as I'm sure you know, but it's worth just bearing this in mind. And we need to refer to qualified professionals because that is their specialism and that is their area. The specialist is not your GP or the individual's GP. And the first port of call will be the high street optometrist, and they will be in the best position to decide if onward referral is necessary, and they may well be equipped to undertake the kind of initial investigations or indeed full investigations that will help that individual move along. So what we can do as SPLD assessors is support the individual in finding things that might work and help. So it's okay for us to talk about the layout and density of text, the spacing, the benefit or not of using different font styles, playing around with background colours on the screen. This is kind of accessibility. information, and it's perfectly valid for us to do that. What we're definitely not doing is diagnosing visual difficulties. We're not suggesting that any of this is related to dyslexia. It's a very separate area to dyslexia. But obviously, if you have dyslexia and this kind of difficulty, it's going to potentially make the literacy more challenging. And we won't be offering screenings for visual stress and pulling overlays out as part of an SPLD assessment. So this isn't news. This is what's been established for quite some time, but it's good sometimes to just go over these things and make sure we're all in line with the expectations. So examples of adjustments might be worth us having a look at. So let me just show you some examples of the kind of things that are talked about in the guidance. Appropriate levels of lighting and the impact of windows and how that can have an effect. And this is things that impact on individuals in a classroom setting, in the workplace, at home. You know, these are cost-free most of the time, but can have a positive impact. So these are all things that it's okay for us to be having a look at with our person. Basically, we've just got to follow the steps that have been set out for us. So we need to update our forms to make sure we're on this version that we've just looked at. We're not offering overlay screenings. We need to explain to people and manage expectations that vision professionals look at this, not us. We're just doing a screening and referring on if there seems to be a need. And that our role is very much in the realm of SPLD. And it'd be really good, if you haven't already, to look at the local optometry services and see if you can build a good relationship there, particularly if that optometrist is on the same page as regard to what dyslexia is and isn't, and if they can undertake over and above a standard eye test in terms of the monocular vision side of things. But also sometimes they will look at colour and whether that's going to be beneficial. So we do need to bear all of this in mind. And if it's looking like it's having a substantial impact on the individual, it might be best to pause the assessment and not go ahead at that point until all of this has been explored with a specialist. So to initiate and facilitate the referral, SASC have provided us with an update of the visual difficulties referral letter. So you can download a copy of that as well from the SASC website. It's a part of the visual difficulties guidance. So a little bit of a whistle-stop tour. There's more to be said. If you really want to be the best assessor that you can be, you will read that visual difficulties guidance document from SASC from start to finish, and you will already have implemented the visual difficulties protocol. So I hope that's been helpful. Just as a quick reminder, some of it's going over old ground. But do make sure you're au fait with this. It's really important that we get our role right, and then it really facilitates the assessment process for the individuals that we're assessing.